September is Falls Prevention Month.
According to the Centers for Disease Control, Wisconsin has the highest rate of fall-related deaths in the United States, more than twice the national rate. That is an incredible statistic. Dr. Ann O'Rourke is the One Adult Trauma Center. Dr. O'Rourke, good to see you.
Thanks for having me.
So we are living in the wrong state for this. I can attest to it myself. I fell on the ice last winter and broke my wrist. And when that happened, I said to myself, why do we live here? But that is really a startling statistic.
It is. I've lived and worked here for a long time, and I have a master's in public health as well. And it is one of these population statistics that we as a state really can't get our hands around as to exactly why that is. But it is certainly a huge problem for us here in Wisconsin. At our Level 1 Trauma Center, we admit over 3,000 patients a year, and about half of those, the injuries are a result of falls.
Wow. And it's pretty costly, pretty expensive for the society.
Very expensive for the state and for the nation as well.
When you think of fall, people fall down. It's not that big of a deal, but it really can have devastating consequences, especially if you get when you get older.
As we age, certainly we are more prone to fractures as we have osteoporosis, and it is a very expensive and really people's lives are changed very much by this. You think, oh, I just fell down, I broke my wrist, but instead imagine you fall down and you break your hip or several ribs or have a traumatic brain injury, you lose your independence, and maybe even die. About 6% of our patients here in Wisconsin that are admitted for falls don't survive their hospitalization.
So how can we prevent them?
That is a great question. There are plenty of programs here in the community, especially this month because it's Preventions of Falls Month. Our Safe Communities is really Dane County's warehouse for safety, and falls prevention is one of their main things. One of our most successful programs is a program called Stepping On, and there are many courses throughout the community that people can reach out and take, and a third of falls can be prevented just from taking that Stepping On class.
The Stepping On class, what does that involve? Like buying a good pair of yak tracks, which is what I will be doing this winter?
Certainly there are some tricks about how you can make yourself safer, but some of it is also just your balance. I mean, things like, for instance, you know, as we get older, our eyesight is not as good, and when I first got my bifocals, I can't walk down the stairs anymore because I have to either take my bifocals off or hold on to the railing. Just little tricks like that, but also just helping improve your balance and knowing where your body is in space.
Certain classes can help with that?
Absolutely. That Stepping On class is a great class. There's some other Tai Chi for people whose balance is a little bit better. And then for people who really their balance is not good, physical therapy can help with that as well.
So is it just a combination of an aging population and a harsh climate?
You know, I don't even think we can attribute it to the climate, to be honest, because certainly what I do for a living is seasonal as a trauma surgeon, and I would say motorcycles, things like that are more in the summer. But falls is all year round.
Really?
All year round.
Not just winter?
Not just winter.
And at home, anywhere?
At home, you know, there's so many things in our homes that were safe when we were younger and aren't as we get older, and things are cluttered. Maybe your furniture's a little too close. Rugs that are on the floor that you can slip on, leaving your shoes around. In fact, I mean, I will admit it, I went down, the other day, tripping over my own dirty laundry, which I left laying on the floor. And there are resources if you are worried about, is your home a safe place to be, that can come out and evaluate your home for home safety to help make your home safer for you, to keep you home longer.
Oh, that's wonderful.
A lot of it preventable.
Yeah, very much so.
Well, Doctor, thanks for being with us.
Thanks so much.
Great to see you. Thank you so much.
Thanks.